This medication, Kogenate FS Vial, is used to control and prevent bleeding episodes in people with low levels of factor VIII, also known as hemophilia A. It is also used in these patients before surgery to prevent bleeding. People with low factor VIII levels are at risk for bleeding longer after an injury or surgery, and for bleeding inside the body, especially into the joints and muscles. Kogenate FS Vial contains a man-made form of factor VIII, also called antihemophilic factor, which temporarily replaces the missing factor VIII, a protein, clotting factor, that is normally in the blood. This allows the blood to clot and the bleeding to stop. It's important to note that this medication should not be used to treat von Willebrand disease. The recommended daily dosage and optimal timing for this medication should be determined by your healthcare provider. This medication is given by injection into a vein as directed by your doctor. The medication may need to be given more slowly over a longer time depending on your dose and how you respond to it. After first receiving this medication in a hemophilia treatment center or hospital, some patients may be able to give this medication to themselves at home. If your doctor directs you to give this medication at home, read the patient information leaflet available from your pharmacist before you start using this medication and each time you get a refill. Learn all preparation and usage instructions in the product package. Learn how to store and discard needles and medical supplies safely. If you have any questions, ask your healthcare professional. If the medication and the solution used to mix it were refrigerated, bring both to room temperature before combining. After adding the solution to the powder, gently swirl the mixture to completely dissolve the powder. Do not shake. Before using this product, check it visually for particles or discoloration. If either is present, do not use the liquid. Use right away according to the product instructions. The dosage is based on your medical condition, age, weight, blood test results, and response to treatment. Follow your doctor's instructions closely. Tell your doctor if your condition does not improve or if it worsens. Some common side effects of Kogenate FS Vial include flushing of the face, headache, nausea, and fast heartbeat. These can be minimized by giving the medication more slowly. You may also experience burning, redness, or irritation at the injection site, fever, and chills. If any of these effects persist or worsen, be sure to inform your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential risks. Most people who use this medication do not experience serious side effects. While it's rare, a very serious allergic reaction to Kogenate FS Vial can occur. Seek medical help immediately if you notice any symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, trouble breathing, or chest discomfort or tightness. This is not an exhaustive list of possible side effects, so if you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting Kogenate FS Vial, it's important to inform your doctor or pharmacist if you have any allergies to antihemophilic factor products or any other allergies. Some brands may contain additional ingredients that could cause allergic reactions, so it's crucial to discuss this with your pharmacist. You should also share your medical history with your doctor or pharmacist, especially if you have a certain type of hemophilia called congenital hemophilia A with inhibitors. Some manufacturers recommend monitoring your heartbeat during treatment. If your heart starts beating faster, they advise either slowing down the medication infusion or temporarily stopping it until your heart rate returns to normal. It's important to consult your doctor for more details on this. If you are pregnant, Kogenate FS Vial should only be used if clearly needed. Be sure to discuss the potential risks and benefits with your doctor. It is not known if this drug passes into breast milk, so consult your doctor before breastfeeding. When taking Kogenate FS Vial, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval to ensure the optimal effectiveness and safety of Kogenate FS Vial. If you or someone else has taken too much Kogenate FS and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call the local poison control center at 1-800-222-1222. In Canada, you can reach out to a provincial poison control center for assistance. It's important not to share this medication with others. Your doctor may also want to do lab tests, like checking your factor VIII levels, while you are using this medication. Be sure to keep all your medical and lab appointments, and consult your doctor for more details. Remember, it's crucial to stick to the dosing schedule given to you by your doctor. If you happen to miss a dose, make sure to consult your doctor or pharmacist immediately for a new dosing schedule. Avoid doubling the dose to make up for a missed one. When using Kogenate FS Vial, it's important to store it as directed by the manufacturer. Make sure to ask your pharmacist if you have any questions. Do not freeze the product and keep it away from light. After mixing, use the product within the specified time frame and throw away any unused portion. Remember to keep all medications out of reach of children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly dispose of the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.